You do everything you can to avoid having to make a presentation at work. But when you are forced to, you have sweaty palms and palpitations. Social anxiety disorder is widespread and affects about 1 in 10 adults and teens. Dr. Jelena Kecmanovic, a psychologist from Washington, D.C., shares her insights about social anxiety disorder.
Baransu Balance podcast with Dr. Ince emphasizes the interdependence and importance of a healthy mind, body, and soul.
Welcome to another episode of Baransu Balance podcast. My next guest is Jelena Kecmanovic, and she is an adjunct professor at Georgetown University's psychology department. She has over 30 years experience as a clinical psychologist and researcher. She's a writer for the Washington Post, CNN, and other media outlets. Welcome, Jelena.
Thank you so much for having me.
Okay. So social anxiety disorder, from what I understand, is one of the most common types of anxiety and affects, by one stat, about 15 million Americans. And I understand a common problem in your practice. Yes. So I have some questions from my audience. I'm going to start off with Kamiko from Nashville. She asked, why do I have this anxiety? Where does it come from? And is there anything I can do to overcome it?
Well, so in terms of where does the anxiety come from? So, I would say generally anxiety problems, so anxiety disorders, and then, in particular, social anxiety disorder, come on as a combination of nature and nurture, right? As is true for many psychological problems, well, not many, actually, most psychological problems and disorders, and even physical disorders, right? It is a combination of some genetic predisposition. So, very often, in most cases, I would say, if I have a patient who is anxious, especially if they've been anxious for most of their life, and social anxiety disorder tends to show pretty early on in, late childhood, teen years, and it's lifelong disorder. So when I hear that, when I take family history and ask, well, were your parents anxious, either of your mother or father, or were there other family members that were anxious? Almost always, I would say 90% of the time, the answer would be yes. There was, there was somebody, or usually several family members, that have been anxious as well, and might have had anxiety that attached itself to different things. Maybe they had panic disorder, maybe they had some phobias, maybe they had kind of generalized anxiety. But the sort of anxiety disorders in general have, as we would say, genetic loading, genetic predisposition. And so it's partly inherited, or your predisposition to it is inherited to some extent, right? Okay. And now, then a second, so that's the nature part. And then the nurture, of course, also makes a difference, right? So that starts with, young age, right? In the past, Freud used to say that, by age 5, what matters to you for your development has already happened. Now we know better. We know that, those early years, so age 2, 3, 4, 5 matter, but as do years all up to, 18 or even 25, right? When your kind of, prefrontal cortex, develops for the most part.
Okay, so the brain is still developing past age 5 up through early 20s.
Yes, exactly. The early to mid. Yeah. Everything that happens to you, like the nurture is basically everything that happens to you, right? We know that some experiences are more potent than others. So family environment, parental relationship with parents, adverse childhood events, of course, anything more dramatic like abuse or neglect are going to leave you vulnerable to psychological disorders. But also, parenting situations or situation with your peers that felt you feeling, insecure, not always sure what's going to happen. So environments that were kind of not reliable, that, you know, you were
Okay.
always wondering when the next shoe is going to drop, right? What's going to happen next, right? So, you know, that insecurity, that uncertainty tends to, you know, feed into anxiety for obvious reasons, right? When we don't know
Okay.
what's going to happen, we're going to become
Mm.
more anxious. And there's a concept called anxious attachment that develops in, you know, families where the parents are either, you know, unreliable. You know, sometimes they're there for you and they meet your needs, and sometimes not, and you never know which mother you're going to get, or which father you're going to get, or which
So
caregiver.
it doesn't necessarily have to be obvious physical or psychological abuse, but it could be something uh, neglect, you know.
It can be neglect. It can be
Hmm.
not, you know, not always, again, reliable, not always responsive to your psychological need. It can be overly critical, or it can be, which is, I would say, probably most common these days, what we see is, you know, over involved parenting, right? There's that there have been different terms
Ah,
have been, you know, thrown out there.
helicopter mom.
Helicopter
Oh,
parenting.
okay. So,
Yeah, yeah, or snowplow.
Yelena, let me skip to one of the questions that I had. So, schools just started, kids starting new grades, new schools. What is the difference between a shy, introverted child and a socially anxious one? And what if you are that anxious parent, the helicopter mom? How do you decrease this effect on your children?
From your children. So, you know, as I said, but there's a predisposition that kids carry. You can probably see quite early on in your child if they're shy. Shyness is not pathological. You know that, you know, it's not. It's a trait like any other trait. Some people are just more easygoing, open socially. Some are more shy. Shyness does not become social anxiety until it becomes kind of pervasive, and until, you know, it starts preventing you from engaging with different, you know, things in life, right? So when a shy kid, you know, starts avoiding, you know, clubs, so doesn't want to join anything, or even starts avoiding school because they're, you know, they're so shy that they're so uncomfortable in social situation, and they start, you know, it starts impacting their life in a major way, then we're talking about social anxiety.
Um,
Introversion is a different thing. So shyness is just being, again, it's a kind of low grade social anxiety where you just kind of feel, you know, just a bit uncomfortable, you know, just trepidatious, just, you know, really in social situations where you're like looking for signs of approval. You don't feel quite you belong, maybe, like you are afraid of being rejected. That's shyness, and it kind of is on a continuum to social anxiety, which is kind of more severe form of shyness that comes with impairment problems, you know, in terms of how you're living, right?
Okay,
Affecting.
so the definition of social anxiety is basically if this shyness gets in the way of your everyday living and activity, if you go out of your way to avoid situations that you probably shouldn't avoid, whether it's a family gathering or a work assignment. Is
That's
that?
right. Or classes where you have to speak in front of the
Mhm.
class, or, you know, joining a soccer club even though you love soccer, that kind of thing. Yes. So so social anxiety and shyness are kind of on a continuum. A different completely different ball game is introversion. Introversion is, again, personality trait, and people who are introverted actually can feel completely comfortable in social situations. Just the difference between introversion and extroversion is that people who are introverted derive psychological energy from being by themselves. They need a lot of time in solitude to recharge. So
Okay,
they
so introversion is not a pathologic.
no, no, not pathological at all. It's just a
Okay.
trait. Extroverts get energy from being with other people. Introverts get energy from being by themselves, right? But introverts
Hmm.
also need other people. Just, you know, they're gonna spend less time with other people, and that's the optimal way of being. But they, in social settings, they can be, you know, they can be very, very comfortable, right? So it's not the same
Okay.
as social anxiety, right? So
Okay.
yeah, so in terms of, if you're noticing a kid, right? If you noticing your own kid, right, who is on a shyer side, right? Who you're on a playground, you know, you see a bunch of kids kind of playing there. and your shy kid is kind of standing off to the side and not really joining a game, and is having a hard time kind of joining the group, joining the the game, the play and so forth, or a kid who you are encouraging to join, again, a club, a rec club in school and so forth, and they're saying, no, 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 I just don't want to do that. I just, I'm gonna come back from school and stay home. And then maybe when you talk to them, you realize that they would like to, that they have a desire, they would like to have more friends and be more with kids and so forth, but they just feel uncomfortable. What can you do as a parent? The the worst thing that you can do is be overprotective or helicopter or snowplow parent, where you're trying to sort of accommodate kids' anxiety and be very afraid of pushing your kid, to face the anxiety little by little, right? In the end of the day, the only way out of anxiety is through anxiety. There are no shortcuts. Even the gold standard therapy for anxiety is cognitive behavioral therapy, and in particular part of cognitive behavioral therapy called exposure therapy. And what is exposure therapy? Exposure therapy is basically gradually, systematically exposing yourself or kids to feared situations. So the parent, when you start to notice that these problems are developing, what you can do is facilitate social engagement, right? Little by little, right? So invite maybe your kid has mentioned, friend Bob, and you say, well, how do you feel about play date with Bob? It's like, oh, no, 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 that's too sort of anxiety provoking. Well, maybe, you befriend Bob's mom. And next weekend you invite Bob's mom or Bob's mom and their partner, or their spouse, with Bob over, so that you're kind of facilitating. Oh, now the adults are getting
Oh,
together, and you kids play there, right? So
okay.
instead of saying, oh my God, your socially anxious kid is crying, they don't want to join this, encouraging them, creating situations where they kind of have to, push through the anxiety again, little by little, where they develop those skills and become more comfortable, is the way to go. Because
Okay. So,
yeah,
so you have a child, let's say her name is Mary,
yes,
and you notice that she is hanging out on the periphery. She doesn't have any other, medical or any known developmental delay issues.
huh,
And so, and you yourself are an anxious mom. So you you have to decide that you are going to allow your child to be in uncomfortable situations
yeah,
on purpose.
yes,
I
yes,
mean, not necessarily to overwhelm them,
yeah, no,
like
exactly,
leave them alone at a party
yes.
with 50 kids, but
Right. Not that,
but
but maybe there's a gathering of few kids, right?
right,
Yeah,
right,
yeah.
right.
What happened?
Or if they have a fear of speaking in public, you
Mhm.
know, start off with a small group, maybe
Yes,
family members, having them recite a verse
that's right.
or play the piano.
Absolutely. Absolutely. That is exactly the way to go. And if you're an anxious parent yourself, that's going to be even harder for you. And sometimes I feel
Mhm,
that anxious parents, when they realize that their kid might be going down the same path, and
mhm.
that they might end up with anxiety, that becomes enough of a motivator or impetus for parents, first of all, to go sometimes take care of their own anxiety, go get
Exactly,
medication,
exactly.
and
Okay.
so because they don't want to, see their
Mhm.
kid in the same way, right?
Okay. So I'm going to veer to something I thought I was going to talk at the end about. And so you were talking about the anxious parent probably might want to get some help themselves.
Yes.
And I wanted to skip to a line that I saw in the prefix of your father's book.
Hmm.
It says, although psychiatrists give no thought of the mind-body relationship, and it goes on to describe the book. And so, the title of this podcast is balance, baransu balance. Baransu is actually Japanese for balance.
Okay.
Balance of the mind, body, and soul.
Yes.
And I am of the opinion that if you have problems with anxiety or depression, that you need to take care of the body and the
Oh,
soul for the mental to be fixed.
absolutely.
So, I mean, you can't just sit in bed all day in the dark.
No, no,
And I
no.
don't see that emphasis in our literature. Now I'm
Right.
speaking to you as doctor to doctor.
Yes, yes. No.
I looked at a recent New England Journal
Mhm.
summary on the treatment of resistant depression and went
Mhm.
on about second line treatment like electric shock and
Yes,
ketamine. Not one word or line that I could find in that article about
yes,
the importance of physical health.
absolutely. Absolutely.
A quick break for a couple of tips from the Washington Post article by Dr. K. Social anxiety can be limiting. There are ways to get relief. Social anxiety involves an intense fear of embarrassment or rejection and can lead to severe problems. A person may get stuck in a vicious cycle that shrinks their life choices and can lead to profound loneliness, depression, and or substance abuse. Dr. K states it is vital to be aware of your feelings other than anxiety, anger, and depression can lead to further poor social interactions. A cornerstone of treatment involves gradually increasing anxiety-producing situations while decreasing safety measures such as not speaking up at a work meeting or wearing inconspicuous clothing. Well, back to my conversation with Dr. K. So, we were just talking about the mind-body connection. Did you have any comments about that?
Sure, absolutely. So, you know, I'll give you an example of a patient I saw the other day, and I will change identifying details. Somebody who, let's say they're in their 30s, and this person came to me and said they are incredibly anxious. They worry all the time. Their mind goes into this catastrophizing places. They can't unwind in the evening. They start to have insomnia because their worries keeping them up at night. They're just kind of keyed up all the time. They seem to be like, as they said, full of adrenaline all the time. And then I asked them about the context of their life. And the context of their life was that, they used to be, a pretty healthy individual who worked out a couple times a week, loved nature, loved hiking, loved swimming, has a spouse and a couple kids, and had a, high-tech job that was, reasonable hours, not 9 to 5, but like, maybe nine to 6, and they would come home and have a dinner with their spouse, and then they would work maybe a couple more hours, but mostly not, they wouldn't work on weekends. And they recently changed jobs, and they got a job, in with one of the big tech companies actually, and the job was taking 15 hours a day, whereupon they go to the office and they don't get up from their desk for pretty much 15 hours. I mean, that is, talking about, not moving your body or being under stress. So unrelenting stress whole day, you sedentary, if you eat anything, you eat some, kind of junk food, basically, at your desk. You don't see sunlight, right?
Right.
Uh, they stopped exercising. They stopped eating dinner with
It's
their.
a recipe for disaster.
It is, and then they were. But what was interesting to me, they were surprised that they were doing so badly.
Mhm.
It's like I find that we so often get into situations, and sometimes because we have to make a living, because this is it's a hard country, to live in, America. So it's a pretty brutal country, right? And we find ourselves, or in situations, so we have to choose those situations to survive, we end up living really unhealthy lives. We are, overworking. We are sedentary. We don't move our body at all. We don't spend any time outside. We don't see sunlight or daylight at all. We are not sleeping enough, right? We are eating unhealthy food, highly processed food. And if you do that, you're going to end up with, of course, slew of physical illnesses that I'm sure you talk about regularly. But on my side, you're going to end up with anxiety, depression.
Absolutely.
We cannot expect people to be normal in abnormal circumstances, right?
Right. So,
We
I mean, even if you have strong genes,
yes,
but
yes,
add that to a gene pool that has some susceptibility to
yes,
anxiety and depression, and you're
and you
holed up in the office without access to the sun,
yes,
no.
you're gonna end up, in a really bad shape. And
Hmm.
what pains me when I see what I see in our society, what pains me is that, you know, folks who end up in these kind of situations go to their doctor, as a primary care doctor or psychiatrist, or they come, to me, and they say basically, well, how do I fix it? I can't, or I'm unwilling to, or it's too hard to start to change my situations and, the way I live, my lifestyle, but I want a quick fix. So then, often they are given antidepressants, right? Antidepressants
Hmm.
are among the most widely prescribed medications. SSRIs are in our
Hmm.
society for decades now. And so you change nothing about your environment, but you pop some SSRIs. And if that's not enough, then you add another SSRI, or maybe you up the dose of SSRI. So,
Hmm.
so we are basically, we are
Yes, and your
pathologizing. Yes, yes.
um, underlying serotonin supply is depleted.
Right. That's right. That's right. So we end
So,
up pathologizing, normal reactions to abnormal situations, right? And then medicalizing, this, adaptation to abnormal situation, right? And
right.
that
Hmm.
pains me. That pains me
Right.
because
Right.
what we should be focusing on is like, well, why are you anxious now? Maybe you were not generally an anxious person, and now you can't sleep because you.
Right, right. You should prescribe, or we should prescribe, get out, get some sun, walk.
That's right. Socialize with.
I'm not sure how much reimbursement we will get from that, but
Well,
okay.
as far as I know, nothing thus far, right? But that's interesting. You mentioned that we should prescribe because you might be aware that in some countries, UK is, I think, a leader in this. They had this movement in so-called social prescribing, where doctors would exactly prescribe. They would prescribe, you know, get a coffee with your friend, get more social, walk 4 times a week,
Oh,
be outside in sunlight, right? That they called it social prescribing, and I don't know whether their medical system
oh, okay.
supported this somehow, where they could, yeah, exactly, have a service code. But that definitely was a movement because they
Or
really,
write down a prescription.
yes.
Get a friend.
Yes, exactly. Or again, walk outside, no matter what the weather is, 3 times a day. Sorry, 3 times a week. I mean, 3 times a day would be great, but nobody can, do that in today's society. So, but 3 times a week. So yes, absolutely. I think that our lifestyles, um, and our Western ways of life are absolutely adding to the incidence of anxiety, depression, all the
Yes,
psychological problems.
yes. So I want to get one or two last questions. We have Nadia from Dallas asking, how can you advance your career with social anxiety or climb the corporate ladder or be a
Yeah.
CEO with social anxiety? The two don't seem to go together.
Well, what I would say to Nadia is actually I've had patients who are very successful in corporate worlds. CEOs, I'm trying to remember, they might have not been CEOs at the time, but they were definitely on that path, who had social anxiety. Often they would have a very specific kind of social anxiety, which was actually interesting, which is public speaking anxiety. Public speaking anxiety is a kind of specific kind of social anxiety that's very, very common. Actually,
Very common.
majority of people have that.
Or
And I remember this.
phobia.
Yes, yes.
Mhm.
I remember a patient who, you know, actually used to be okay with public speaking, but then he had a uncomfortable situation. Once he was jet lagged, he was giving presentation in Asia after being jet lagged, and he might have had even like a stomach bug going on. And he went into this meeting that was incredibly important, and he stumbled and he was uncomfortable. He was hot, and he kind of attributed the physical signs to his anxiety, although probably physical signs were due to his jet lag and his stomach bug. However, what ended up happening is that he started having this huge fear about
Uh,
public speaking
uh,
after that, and he was,
dreading.
yes,
Mhm.
dreading any kind,
Mhm.
even like a meeting, of
Mhm.
a group of 5 or 10 people, right? In the
Mhm.
boardroom, and he was pretty high up in the corporate ladder, right? And
Mhm.
so we worked on that. You absolutely can work with that. I would say please not let social anxiety is one of the more treatable psychological disorders. Not that stop you. It's not a sort of it's not a fate for life. I mean, it's not
Mhm.
something that you that cannot be helped and treated. It can be, it absolutely helped and treated with cognitive behavioral therapy, and medications can help as well. So I would say that, rather than saying I have this and thus I can be CEO, I would say, seek help, seek a good therapist who is trained in CBT, cognitive behavioral therapy. And
Okay.
then, when you work with them, if they suggest that also some medications could be of help, do that as well, and follow your dreams. This should not be
Okay.
one of those things that stop you.
Okay. I like the cognitive behavior therapy
Yeah.
because it goes it's not the goal is cure. I
Mhm.
know in or remission. In oncology we use that word a lot. We want to put something in remission.
And yes,
So
yes, yes.
and
Well, it's interesting actually. I wonder, would that actually fit with in terms of what we do? I mean, what we talk about with our clients is if somebody has been anxious for most of their life, they kind of have a little bit of that anxious temperament, right? CBT or any kind of therapy or medication is not going to make the most chill person, right? I mean, we're not going to change your personality. We're not going to change your, personality traits that you've kind of exhibited from very young age. That said, we absolutely can change the level of anxiety or how you relate to anxiety, and how, on average, what level of anxiety you experience in various situations, so that it doesn't have to get in the way of you living life the way you want to live your life. We
okay.
absolutely do that, right?
Okay,
So
because I mean I definitely had the fear of speaking in early adulthood, and I would seek out opportunities to speak on purpose, even if I
yes,
had to read every single word of the presentation.
and
And
look
so
at
and that
now.
now people say that I like the microphone, which is not
Yes,
quite true, but
but I was gonna say, but here you are. You are
oh,
a
that's,
podcaster. You are a podcaster. I mean,
oh,
isn't that
that's
a
true.
really
That's true. This
beautiful
is
story?
not my natural persona. I mean, if I could hire someone to do this,
You
I
would.
would.
And yet you're doing it, and you're doing a great job. So
Right.
I mean, you are a better example than anybody. I think this is a really, really beautiful story that
Yeah.
I bet a lot of people would say, "Oh, come on, I can't believe that you were afraid of public speaking."
Oh no, my
But
kids say that, and I said, you don't know your mother? Oh my goodness.
yes, 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 and here you're saying you were, and you
Right.
overcame. So it's possible. It's absolutely possible. It's
Right.
absolutely possible.
Okay. So, Helena, I mean, Yelena, I'm sorry. So you have a very interesting background. Can you just briefly tell us your story uh, as
Sure.
we get ready to sign off?
Yeah. Well, I'm an immigrant to this country, as exemplified by my strong accent, even though I've been here at this point a little over 30 years. But I am from ex-Yugoslavia, so a country in Southeast Europe, that was a really actually lovely place to grow up in. And I grew up with in a lovely family. My father was a psychiatrist, so I was exposed to mental health kind of world very early on, and grew up with books of collected works of Freud and Jung on the shelves and so forth. Being that my father he was an academic psychiatrist, so he was a professor and also practiced in a major mental health hospital, which is part of a university hospital in Sarajevo. So I'm from Sarajevo. The town used to be known for Winter Olympics in 1984. Unfortunately, then later it became known for war. So in 92, a war broke out in my country, and Sarajevo was one of the worst places. It was besieged for about 3.5 years, and civilians were targeted. And so my family, we were the lucky ones, though we were in the war for a while. So the life as we knew it ended, and this really actually comfortable, secure life just ended overnight. And so we were under siege for a couple of months, and then we're able, at least a part of the family, were able to get out. And then we're basically looking to immigrate. We were refugees and looking to immigrate wherever we could. And it just so happened that I ended up in the States. So I came here in 93, and my parents with my younger sister ended up in Australia. And so
Okay.
I then kind of, had to fend for myself, right? And it was that what happened when I was 20 really has influenced my life pretty tremendously, because I think I was a little bit sheltered. I grew up in again, as I said, very supportive family and an extended family. And, it was a small, big town where everybody kind of knew each other, and everything was pretty predictable. And then I was here in a new country. I spoke some English. I mean, my English was okay, but it wasn't my native language. By myself, trying to figure out how to make it, how to go to university, what to study, and it was hard. It was extremely hard. And I think, though, I do think that my current resiliency has been developed through that struggle.
So your parents, not on purpose, but they weren't there to pick up the pieces or
No,
to help you
no,
with the struggles.
nobody was here. I
Mm,
found myself at age 20 coming to America alone, and I still do not have any family members in this country except for now, blood relations. It's my son, who is 22 years old and just graduated from college. But that's it.
and
That's it.
congratulations on that
Thank you.
milestone.
Thank you. Thank you. So it's been a long and hard road. And
Mhm,
some resiliency, a lot of hard
mhm,
work, and a lot of help from a lot of kind people,
mm,
have
mhm,
helped me along the
mhm.
way.
Yeah,
A
you've you've
lot of
you've made such tremendous contributions. I'm honored that I was able to speak with you today. Uh,
Thank
I
you
said
so
that
much.
was the last question, but one last one. So
Yes.
Crosby from Nashville, she asked, "Is there such a thing as useful or good social anxiety?" And she points out to the fact that some people don't seem to care what people think about them.
Yes, yes. Well, that I actually don't believe that there's anybody who really doesn't care what people think of them. They might seem like it, and I'm
Oh, okay.
with her. They might seem like it. They put an air of like, oh, I really don't care. Deep down, everybody cares, because you
Yeah.
know why? Evolutionarily, we are sort of programmed to care.
Mhm,
When you think about our ancestors, right?
mhm,
if you if you were to be sort of expelled from a tribe, or like if you didn't belong to the tribe somehow, or you made people mad, or people didn't like you, and you were pushed out of the tribe or expelled from the tribe,
mhm,
that meant death. I mean, at that time,
mhm,
that meant death, right? So
mhm,
some social anxiety, right, and just, caring
Yeah.
and thinking about people,
Yeah.
what
So a
they
little
do.
bit of nervousness is okay before a performance. It kind of
Absolutely.
gives you an edge.
It gives you
So,
an edge, but also, like worrying and caring what people think of you is very normal. I think that's very normal because, again, that's part of our evolutionary past. So I think that, next time when you see somebody who you think really doesn't care, I bet you that, deep down, or maybe not so deep down, they actually do. They're just trying to cover it up. Usually it's trying to cover it up, and it's usually I hear, I hear behind the closed doors in my therapy room,
mhm,
I hear people talking about their vulnerabilities that somebody from outside would never imagine. Because, I
mhm,
work in DC, there are a lot of incredibly successful people, right? Who
mhm,
are, who are in all kinds of professions. And I bet if we ask people around them in their professional setting, they would never guess that some
mhm,
of these folks, right, are struggling with all kinds of, sense of low self-worth or questioning themselves or being socially anxious
mhm,
or being depressed or
mhm,
they would never guess because they
mhm.
cover it up and they're able sort of to get going and and push through it. And yet, underneath the surface, there's a vulnerability. We all have vulnerability. That's part of being human.
Okay. So is there a website or a number that people could reach you at if they are in the DC area and need a therapist
Yes,
or read your articles? That's how I found you, a Washington Post article about social anxiety.
yes. So the best way to find me and everything is in a website, the way you
Mm-hmm.
can reach me, all my articles, my appearances, my talks, are on my website. And because nobody can quite pronounce my name, I go by Dr. K. My name is Jelena Kecmanovic, I go by Dr. K. So the
Okay.
website is drkpsychology.com.
Got it.
drkpsychology.com.
Okay.
And so everything is there, and I'm working on a book. So when a book hopefully one day is published and can be bought, it'll be on my website as well.
Okay. We'll have to have you back before then, but thank
Yes.
you.
Thank you so
Okay.
much for having me today. It was a pleasure talking to you.
Thank you. Okay.
Please see the attached PDF document for further references and Dr. K's website. You can do something about social anxiety, even if it stems back to childhood. That includes a number one, healthy lifestyle that does not include sitting in front of a computer for 15 hours a day. Number two, gradually expose yourself to anxiety-provoking situations and decrease protective mechanisms such as not speaking up at work or joining in conversations in social situations. And number three, getting professional help, cognitive behavior therapy. Give yourself a break. No one is perfect. Self-compassion versus self-criticism leads to compassion for others. There's a verse in the Bible, love your neighbor as yourself. Oh, and a little anxiety or concern about other people's opinion is okay. There's that balance. Remember, this podcast is for educational purposes only and does not substitute for advice from your personal health care or mental health provider. This is Dr. Christine Ince wishing you a balanced mind, body, and soul. Please like, subscribe, and share. Thank you.